Hello guys, today we are going to discuss about a laboratory test called erythropoietin. It's a hormone. Use of the test either to help tell the difference between polycythemia vera and secondary polycythemia or to help tell the difference between different types of anemia. It also shows whether the amount of erythropoietin being produced is appropriate for the level of anemia present. This test measures the amount of erythropoietin in the blood. Erythropoietin is a hormone produced mainly by the kidneys. It is produced and released into the bloodstream if the blood oxygen levels are low. Erythropoietin is carried to the bone marrow where it works to stimulate stem cells to become red blood cells. Red blood cells contain hemoglobin, a protein that carries oxygen throughout the body. Normal RBCs have a lifespan of about 120 days and are usually similar in size and shape. The body has a dynamic feedback system that attempts to keep a stable number of RBCs. If there are too few produced or too many lost or destroyed, or if RBCs are abnormal, then the patient will become anemic and their ability to carry oxygen will be reduced. Normal red blood cell production relies on functioning of the bone marrow, on an adequate supply of iron and nutrients such as vitamin B12 and folate, and on an appropriate concentration of response to erythropoietin. The amount of erythropoietin released depends upon how long the oxygen concentration is and the ability of the kidney to produce erythropoietin. The hormone is active for a short period of time and is then removed from the body in the urine. Increased production and release of erythropoietin continue to occur until oxygen level in the blood rises to normal or near normal concentration. Then production falls. However, if the kidneys are damaged or unable to keep up with the demand for erythropoietin, or if the patient's bone marrow is unable to respond to stimulation, then the patient may become increasingly anemic. If there is too much erythropoietin produced, such as may occur in some benign or malignant kidney tumors, and with a variety of other cancers too, too many RBCs may be produced. This can lead to an increase in the volume of a blood in the circulation, an increase in the blood's viscosity and hypertension. In one type of polycythemia called polycythemia burra vera, the excessive production of red blood cells occurs independently of erythropoietin level. In these patients, the erythropoietin level may be quite low. In patients with other form of excessive red blood cell production usually associated with the lung disease, the erythropoietin level is high. Sample required is blood, normally 2.6 to 18.5 milli units per milliliter. That is about erythropoietin.